Hi, I'm Mark.
And I'm Leanne.
And we're the team managers of the Forensic Community Service.
The aim of our service is to support you in your recovery, your journey towards discharge and living in the community.
And now, some of the team are going to tell you what to expect while you're working with us.
I'm Rue. I'm a higher assistant psychologist working in the Forensic Community Service. In the Forensic Community Service, we have qualified psychologists and higher assistant psychologists. As a higher assistant psychologist, we help to promote the recovery of individuals. The qualified psychologists can offer more specialised therapies, such as EMDR, which is a talking therapy looking at the effects of trauma. As a team, we may discuss who may benefit the most from psychological input. We will also include the individual in the discussion about their treatment plan, as well as their carers. Some of the things that we may offer to an individual include therapies and support with staying well, understanding their mental health, talking about the effects of trauma, managing risk, managing difficult and strong emotions, and also understanding more about their mental health.
Hello, my name's Caroline and I'm a specialist occupational therapist. Part of my role is working with patients who are on the way to being discharged from hospital, and also patients who are already discharged from hospital and living in the community. I work with patients to assess their strengths and difficulties in all areas of activities of daily living. I will help and support you to reach your goals and to become as independent as possible.
Hi, so my name's Nick. I'm an occupational therapist working for CNTW in the community mental health team. So part of what we do is we help patients work towards resuming, maintaining and developing their life skills and work towards recovery in everyday activity. We want to work with you to improve your confidence in yourself and in what you do. We want to support you in developing roles that you might have, any responsibilities that you take on as part of those roles, and also with your relationships, whether that's with your family, your friends, or the staff that you work with towards your recovery. So we know that whatever you do on a day-to-day basis has a big impact on how you feel, and it has a big impact on your life. So being able to manage your life and be able to be independent and manage those activities that you value has a big impact on your physical health and your mental health. So occupational therapy will work with you to identify any needs that you might have. Will help you to set some rehabilitation goals, and we may even continue to support you to complete and work towards rehabilitation goals that you've already set with the inpatient occupational therapy team, and we'll work with you to finish those in the community when you're discharged from hospital.
My name's Amelia and I am a Community Link Advisor with the Richmond Fellowship. My job role is to help to create clients have independent living skills such as cooking, cleaning, managing property, finances, shopping, anything you can think that is a daily living skill. I help to support with that and learn new skills. I also help to help my clients to create achievable goals which are specific to them. So it could be something as small as opening a bank account, doing their shopping on their own, meeting up with family that they haven't spoken to in a long time, and just giving that reassurance that there is support here for your goals. It's not all going to happen overnight, and we'll just take little steps to achieving them.
My name is Emily. I am the Advanced Nurse Practitioner in the Forensic Community Service. I work alongside the community nurses. Alongside the other professionals within the team, we carry out assessments. We will identify your goals together with you and your care plans for your recovery. We will support you in transitioning from hospital into the community.
Hello, I'm Claire.
Hi, I'm Kim and we're the speech and language therapists. We look at assessing speech, language and communication needs.
We focus on the communication skills that people need as they move into the community, so the everyday skills that you might need to use. We know that this is a really busy time when there's lots of things to organise and lots of information to absorb.
There are lots of different communication skills that we can support you with. One of those things are looking at understanding your health review and treatments, Other things can include making sure that you're able to get your message across when it's really important in times like care reviews, and being able to share your thoughts and opinions on that.
We're great fans of avoiding jargon, of summarising what's been said, and of using information like sketches and diagrams to make information as clear as possible.
Once we know how to support you with your communication, we can then use this and share it with people who are close to you. That includes people like your carers, friends, family, and people who are involved in your care.
Hi, my name's Adrian. I'm a pharmacist working within the Forensic Community Service, as well as working within the secure inpatient wards. I specialise in the safe and effective use of medication whilst you're under the care of the Forensic Community Service. In reality, this can include many things. Monitoring side effects of medication, providing information about your medication, both for physical and mental health, and if needed, linking into clozapine clinics.
Hello, I'm Dr. Goyce, consultant psychiatrist. I'm one of the members of the medical team. Our team can get involved in assessment, formulation, and treatment of our patients. We aim to provide clinical leadership to the wider MDT, ensuring delivery of high-quality interventions.